Hi, this is It's Going to Be Okay with Dr. Roseann, and we're going to be talking about the natural therapies for clinical issues like ADHD, anxiety, depression, mood, OCD. Do they work? And you know what? Surprisingly, I get this question pretty much 14 million times in a week. Yes, they work. Yes, this is my life's mission to teach people about this. And I want to scream it across the rooftops. I want to be on Miss America just to have an audience, right? It's my platform. And I want everybody to know that these therapies work and they can be a game changer in mental health without any of the harmful side effects that psychiatric medications present for many people. And all psychiatric medications have a toxic effect on the brain and body, 100% of them, even safe ADHD medication. That is not there to make you feel bad. That is there to empower and educate you. And we're going to talk about alternatives. So let's talk about evidence based approaches for these clinical issues. And that's all we're talking about. I'm a huge believer in all things integrative, but I want you to focus in on what we know works. And that's when it's in our one-to-one brain behavior reset program, which if somebody wants to work one-on-one with us, we take a tiny amount of people every month, and you can go to drroseann.com/help. And that will walk you through that process. People fly in all over the world, and we work remotely and in person with people, which is so awesome. We can do neurofeedback 100% remote, and we can do PEMF remote, as well as coaching. So let's talk about some of these evidence-based approaches. And most importantly, let's start off with, what does the research say? So the things we're going to talk about are evidence-based, meaning there is good, solid research supporting their efficacy. Again, if there's so many tools out there, and this is what's encapsulated in our program. And I talk a lot about them in my book, It's Going to Be Okay. You can go to It's Going to Be Okay, and beok.com, and you can get my book, and you get a whole bunch of free downloads when you get the book. So if you're looking for specific citations, you want to get this book because it has 40 pages of them. Did we say that again? It has 40 pages. I think I said that 3 or 4 times. So it's important for people to know there are really solid evidence-based approaches that can change mental health, have nothing to do with medication. So let's talk about one of my faves, neurofeedback. So neurofeedback has been around since the late 1960s. It's a technique that regulates the brain functioning at the brainwave level, which supports neurotransmitters, changes gray matter in the brain. It's pretty amazing. And it does it through a process of simple measurement and reinforcement. We use EEG neurofeedback, which is going to directly train specific regions. It's not general neurofeedback. General neurofeedback is fine. Not in my population, not in my complex clinical population, and certainly not for conditions like PANS or people with multiple diagnoses. You just don't have enough control. And again, no, it's about the right treatment for the right issue, right? And this is what I do in my work with my people, and I've tested out a lot of things. So it's a process of measurement and reinforcement. You can listen to the neurofeedback series. There's an awesome whole series walking you through, where we start with a brain map. Then I interpret it, and you have this amazing strategy session where I do a care plan with you. That is why people fly in at least once a week to come and see me, because it's the care plan. It's what you get in 30 years of experience, and you're going to get the guidance to change things for your kids. And so neurofeedback, my gosh, there is so much research on neurofeedback, tens of thousands of research studies, 3,000 peer-reviewed studies alone on neurofeedback. So peer-reviewed means it's a higher level. American Academy of Pediatrics says neurofeedback is as effective, it's a level 1 intervention, as psychostimulants. Yes, let's say that again. So it's the American Academy of Pediatrics since 2012, I'm adding that in, is as effective as psychostimulants. And I think that's so important that parents need to know that, that their kids could be doing neurofeedback. There are providers all over the world. If you can't work with us, we can't work with everybody. You can go to bcia.org. You want a certified provider, and you want a provider who has experience in your clinical area. I have this all mapped out in my neurofeedback series, so please listen. And, really the gist of it is we know when a brain is under or overstimulated, we know we need to regulate it. You can regulate it safely and easily with neurofeedback. It's that awesome. So yes, the research says it's solid with many clinical issues just because it's been around so long. ADHD, anxiety, depression, learning and processing problems, autism, headaches, chronic pain, bladder issues. I mean, it could go on and on and on. There really is, when you're talking about brain dysregulation, there's so many clinical conditions that have brain dysregulation, and neurofeedback works over the structures to train specific structures, but improves brain communication. It's pretty awesome. Love it. That's why my brain works so fast. And you don't need a clinical issue to do it. You don't. My friend's son is a soccer phenom, and he's doing it. How awesome is that? He's little. PEMF. So if you've been following me, you know anything about it. We have our own FDA regulated device called PEMF, and it is designed, the protocols are designed by moi in 5 clinical areas to support the nervous system. What does the research say about PEMF? It says that it's an effective tool to support cellular functioning. That's exactly what it does. It's great for things like anxiety and pain and just overall wellness. So PEMF, high level, sends a signal to the cell, disrupts cellular communication, comes in with a corrective communication, and changes the way the cells are talking. That improves health. It also regulates the nervous system, puts it in a parasympathetic, relaxed state, and then improves detoxification. It's awesome. It's why we are using it. And people are able to learn about it by going to www.drroseann.com and /COM PEMF. I think it's awesome. Okay, diet. It's not a dirty 4-letter word. It's something people don't want. You can calm your brain with diet. To say there's research about the efficacy of diet, like so much research it's unbelievable how much research. What you put in your mouth makes a difference. Okay. And it is often surprising to people. I was talking to a family yesterday and she was like, I know when I give him the dairy, he acts like he's like a wind-up toy all over the place. And she's like, I try not to give it to him, but he's a limited eater. And I was like, okay, let's try to be clean. Let's get it out. And there's a huge impact. Sugar, inflammatory foods. Should everybody not have dairy and wheat? No. But some people, because of an inflammatory component in their brain and body, are more reactive to it. These are high inflammation foods. You can power up the brain even by making small changes, swap outs, and things like that. Huge impact. You must have fidelity. Just like in this case, until she got rid of the dairy in his diet, he wasn't consistently more focused and less impulsive. But when she did, much better, right? Nutrients and supplements. Everybody wants to talk to me about nutrients and supplements. I love it, love it, love it. Our line Neurotastic comes out in August, and we're starting with Multi-Mag Neuro. Get on the wait list. It's on there somewhere on the website. Don't worry about it. You'll hear about it. But let's talk about nutrients and supplements. With so many high levels of stress, right? Compounded stressors, that rev state that I always talk about. We are depleting nutrients at a rate that we can't even get in with an amazing diet. Much better, right? But even Dr. Rowe takes vitamins. I forgot to do it today, though. So what we want to do is we want to be analytical. In a perfect world, you're going to your physician, you're looking at what nutrients are missing, and you're directly supplementing. Between chronic stress, genetic mutations, and poor diet, our kids are not getting enough nutrients. I was just talking to an adult yesterday. One of my software representatives was like, Dr. Rowe, you are so cool. I was like, Love you. Right. And he said, I was feeling so tired. And he goes to a functional doctor and he was a weightlifter. And he said, the doctor found that I was low in B12 and vitamin D. And he goes, and I got vitamin D and B12 and bam, my brain's back online. I was thinking I had ADD. And I was like, I love you for sharing that. How cool is that? So there's a lot you can do. I always want to talk about magnesium. There is a reason why we're starting our supplement line with magnesium. We all need it. The same reasons I said above, but more so because we are so stressed out. And magnesium is a cofactor in 300 chemical processes in the body. And there's just so much research that shows when you supplement with magnesium, we can improve attention, we can improve OCD symptoms, we can improve mood, we can improve our anxiety and stress levels, and on and on and on and on again. You always want to check with your physician, but magnesium is taken to bowel tolerance. But I gave you the deep dive. There are many other things, including prayer and meditation and mindfulness and psychotherapy. These, particularly psychotherapy, is really important when you have behaviors that are around that you're not getting rid of, but it's got to be the right treatment in the right order. And if you're really looking for guidance, right, that's what I do. That's what we guide people, and we support them in the clinical therapies, right? We walk you through, we handhold you, we help your ecosystem in your family, whatever is going on in our brain behavior reset program. And you can go to drroseann.com/help. And there's a solution matcher, and it's also an application to apply to work with us. But I want you to feel good about using natural therapies. Just like anything else, you got to be consistent and you have to use them for a length of time. 3 days ain't going to cut it. You take out, change adding magnesium in a few days, you actually will see a difference. um, Neurofeedback was going to take some time, but it's pretty amazing how it lowers stress levels. And these are therapies that when you're consistent, it really can be a game changer. Yesterday I did a review with a mom with 2 girls, and she was just talking about how her younger one, who's so unfocused and clearly has some learning disabilities, that she can't believe the difference in her focus. And she's been so on top of her neurofeedback. She's been doing it 3 times a week. And that when she went to pick her up, she saw that she was writing something. And she said, what are you doing? And she said, Mom, I'm doing my homework. And the mother said, I literally have never seen her do her homework without her arm being twisted. It was a happy day. So, I know what it's like as a mom when you struggle. So I hope this was enlightening to you. You can go to itsgonnabeokay.com. You can get my book. You can go to Amazon. If you really want to learn more about the specific research, there's also 1 million blogs on my website, drroseann.com/blog. But use natural solutions, feel good about it, and have fidelity, and watch your brain get calm and happy families start to happen.